We're with Kody here, talking about his testimonial here at the Office of Chiropractic Rehab and Neurology. Kody, tell me what initially brought you into our office.
Well, initially, I've been having symptoms with the right side of my body for approximately about 4 years now, and by no means was it a last resort, but we've tried MRIs, we've tried a lot of different things beforehand, and met Dr. Conforti at a duathlon here in Dubuque, and recommended some things, and that's kind of what initially drew us in to come in and visit Dr. Conforti.
And can you tell me what type of medical procedures and testings you had done prior to coming into the office?
A lot of different things. I've had CAT scans, MRIs, physical therapy. I've been to sports medicine, neurology, a lot of different things, and it all really came back negative. Nothing, really jumped out to them, and really just didn't get much help other places.
So it sounds like you had a ton of testing and diagnostics and a huge financial investment.
Yeah.
But, but no real treatment or results.
No, I mean, for the past 4 years, nothing's really come out of it, and spent a lot of money.
Well, can you tell me how your symptoms were affecting your daily life? What did you like to do that you weren't able to do, or to do to the best of your abilities?
Sure. Yeah, I'm a huge biker and runner, and specifically with the right side of my body, have had some weakness coming in, but it's gotten a lot better since I've been seeing Dr. Conforti, and wasn't able to bike as far and run as far as I was used to prior, 4 or 5 years ago. And then sleeping was probably the other big one, just kind of disrupted the sleep pattern, and just standing for long periods of time.
And those symptoms in the right side of your body, can you explain those a little bit more in more detail?
Yeah, so I basically just had right side weakness. When I ran, kind of my right leg kind of caved in a little bit, just got tight, and it caused my left side to have, stuff with the compensation. But it was really just right side weakness was the big thing.
Mm-hmm. And can you tell me, what was it about, our practice or our discussions at one of those prior races that you were in that made you decide that this was the office for you?
Yeah, I mean, the biggest thing was when I originally was at the race, and you just kind of had me sit down on your bench and did maybe 5 or 10 minutes of things, and I don't know, I felt like for me, it was the first time where somebody was like, this could potentially be something, and it kind of made sense to me. By no means am I a doctor, but just the things that you did to me made sense to come in and at least give it, a shot.
In terms of your how your posture affects your function?
Yeah. I mean, he did, to see what the length of my legs were, and I mean, that was, he kind of called my dad over, and he was like, look at this and stuff, and I had always kind of thought that, but nobody really even ever mentioned that as it even a possibility. Mm-hmm. And so it was something like new, that I was like, you know what, and you just get that good feeling. So
what did you recall your father saying when I pointed out your abnormal posture?
He was definitely, his eyes were opened a little bit, and especially because he was the one always taking me to appointments and everything. So to see that, something up close, definitely it helped him out too.
Sure. For those watching at home, can you give us an idea, or perhaps some advice to someone watching at home in terms of searching and having similar symptoms? What advice would you give to them?
Yeah, I mean, for me, obviously the financial, what we spent before, and what it is now. Obviously before it was a lot, weren't getting results. It's money now, but we are getting results, which is really positive. I just recommend to people, especially for athletes, like I said, big runner and biker, would strongly recommend this practice just because of my background and what I like to do, and now knowing that I can actually go out, and I just competed in a race and I was healthy in it, to know that I can actually go out and do that is, I mean, it's awesome, and just the quality of life that you're able to have is a lot better as well.
Yeah, you want to go ahead and tell us what position you came in that last race?
Yeah, got 7th in the turkey trot here in town in the 5 mile, and honestly, it was the first race in 2 or 3 years where I was actually, I finished, I'm like, I actually feel pretty good. So it was definitely promising, and I wish that for everybody else.
And second in your age group, correct?
Second in the age group, yeah.
Correct. Yeah, well, thank you, Kody, for doing this for us. And
yeah, you're welcome.
We're hoping that it can inspire some others to seek care and get the results that you did.
For sure.
Thanks again.
You're welcome.